NGOs, in terms of implementing outcome measures, can learn a lot from the way that implementation of MH Smart has been happening over the last few years. And so they don't have to kind of reinvent the wheel and come up with lots of new stuff. There's lots of learnings already that we can take from the MH Smart implementation.
The NGO sector, for the first time, will receive information out of a national collections system.
We've got clients with both mental health support needs and intellectual disability support needs, so it's quite a diverse client group. And what we've been trying to do is find an outcomes measurement tool that will be able to capture outcomes measurement across that diversity and across the age range, and that's been a real challenge. What we found when we looked at existing validated tools is the more service specific they are, the more comprehensive they are, the less broad their applicability. So the approach that we've decided to take is to have a very simple 3-question tool that can be used across all services, and then look to supplement that with more service-specific tools. So we're taking a kind of both-and approach to that. So far, in terms of all of the validated tools that we've looked for, or that we've looked at, that no one tool is going to do the job that we want across all of the services. There are a variety of reasons why organisations are starting to get into outcomes measurement, and we've heard from the ministry and from our other funders that it's important in terms of accountability, and it's important in terms of ensuring value for money and so on. We'd probably want to be quite clear that the primary driver for us is that we want to ensure that the services we're delivering or the support that we're providing is making a difference for clients. And outcomes measurement is actually a very important part of ensuring that we are achieving that end.
We're a reasonably large NGO in the south of the South Island, and we're using a quality of life survey where we ask our clients about their subjective quality of life, and we rate that over time to look at change over time. We're really interested in finding out what our clients' quality of life is. We've got a lot of measures about, we've got numerical information about where our clients are at, but we really want to get a sense of how our clients feel about their own lives and what difference us as an organisation makes to our clients' lives. We also want to be able to develop our services based upon what our clients are telling us about their lives.
It doesn't actually matter what tool you choose, it's how you use it. So it was really important for us to get across that it's about the process. You know, even if you choose a tool that's not going to be perfect, and what tool is going to be perfect or meet everybody's needs, as long as you deliver it in a process that is collaborative and client-centred.
We've taken a holistic approach to reporting outcome measures, and that was based in the kind of notion that outcome measures can't be considered in isolation of everything else. Organisational culture, philosophy, values will all impact on certainly how outcomes are, which outcomes are used, but also how those outcome measures are interpreted and applied. Outcomes need to be considered as an integral component of all that happens in an organisation, not on the fringe, not in a separate department. It needs to actually be integral. Introducing outcome measurement is a workforce development issue, requiring changes in practice and culture.
Given that NGOs are an important link in providing good services, the capacity to measure inputs, outputs and outcomes as a way of demonstrating value for money is as important for NGOs as it is for DHBs.
Information is tremendously important to our organisation as it is for other NGOs, and what we need in order to be able to describe the value that NGO services provide is information.
We want to see how recovery becomes more of an outcome measure. People getting jobs, people getting relationships, people getting houses, meaningful recovery. We want to see how that's measured.
It just reminded me of what we're doing here, and it's not all just about collection and data and analysing. It's about feeding it back so that we can improve outcomes for service users.
Well, we need to be using that information, easy access, to plan and change what we do in mental health services. But it's also about, information is an incredibly empowering thing. For all of us feel much more empowered the more information we have. So service users, by having easy access to all kinds of information, particularly through internet, are more empowered to kind of question what's going on, to maybe take more control over their lives, to challenge, and to have a good dialogue and debate and discussion in their relationship.
Let's just get on with it, basically. I think that idea about getting on with it is really important. Been a lot of time wasted in mental health, almost kind of addicted to the process of analysis and confrontation. And I've always been kind of frustrated with that. I think, have your examination, have your debate, but then at some point you just got to decide, look, this is what we're going to do and move on with it. Because at the end of the day, that's the only way that consumers will benefit. Consumers don't benefit from this endless sort of hassling about things.